Health officials in Springfield are noticing a trend with their latest batch of COVID-19 cases in the city.
They are warning those who traditionally are not likely to develop severe symptoms to keep their guard up. Western Mass News reporter Audrey Russo joins us live in Springfield to explain. Audrey?
Springfield's health officials say they're noticing an increase in COVID-19 cases in those 30 and under. They're also noticing that there's a vehicle for spreading the virus to those who are 13 and under. There are 34 fewer COVID-19 cases in Springfield this week when compared to last week. But that's pretty much where the good news ends. Health and Human Services Commissioner Helen Carlton-Harris says nearly 50% of the new cases are coming from people 30 and younger. The blue section on this chart.
Those of us who believe that COVID-19 is not affecting our children, it definitely is, based on the data that we have of last week's cases.
In fact, Carlton-Harris says there have been multiple cases documented in children under the age of 13, some as young as 4 years old.
The 11 to 20-year-old, there were 19 of them. There were 13 in the 0 to 10-year-olds.
Western Mass News spoke over the phone to pediatrician John O'Reilly with Bay State Health about how these kids are catching COVID-19.
What we're seeing is that a lot of this increases in clusters among families.
O'Reilly says in many cases, it's multi-generational households where a member is an essential worker.
They come back with COVID, but they're asymptomatic. And suddenly within that household, the baby is sick or the grandmother's sick.
O'Reilly says many of the local kids who catch COVID-19 only have a few symptoms and don't get too sick. However, he says families should still take every effort to protect the younger members like they do the elderly ones.
With this increase, we have to do things a little differently. That at home when you're watching a movie, you may need to wear masks. That you probably can't all sit crowded around a dinner table.
O'Reilly says he's also noticed an increase in Bay State's positive test rate. He says it sits at 1.65%, bigger than the statewide average of 1.1%. Live in Springfield, Audrey Russo for Western Mass News.